I'm Lisa Squire, Senior Communications Advisor for Alberta Health Services, and this is Health Matters. Joining me today is Jen Sturm, and Jen is a public health nurse with Community Health Services here in Medicine Hat. Today, we're going to be talking about influenza. So welcome, Jen. You know, a lot of times people will say, oh, I have the flu, I don't feel good. How do we know that people really truly have the flu? What are the symptoms?
Thank you for that question, because this is a common source of confusion for people. Because oftentimes when we think of the flu, we think of vomiting or diarrhea, when in fact, influenza is a respiratory illness and usually doesn't even cause vomiting or diarrhea at all, especially for adults. But the common symptoms of influenza include cough, sore throat, high fever, often greater than 38 degrees Celsius, body aches, chills, headache, and extreme tiredness. Now, our kids can also have runny nose, sneezing, and possibly, in some cases, vomiting or diarrhea.
So what you've described sounds a lot like a really bad cold. So are influenza and a really bad cold the same thing? Like, what are the differences between the two?
Good question. It is, you're right, there is a lot of overlap with the symptoms of influenza with the common cold, but there are some key differences there, Lisa. One of those being the symptoms themselves of influenza tend to occur very suddenly, and they tend to involve the entire body, versus common cold, usually those symptoms will develop quite gradually, and oftentimes they're limited to the nose, throat, or lungs. So symptoms like headache, body aches, extreme tiredness, joint pain, those are uncommon with the common cold. But with influenza, very common and often quite severe.
So what can we do to protect ourselves?
Well, proper hand hygiene and staying at home when you're sick are good ways of protecting yourself from any virus that can attack us. But the best way to protect yourself from influenza is with the vaccination. Now, vaccines have been proven to be safe and effective at preventing illness and disease, and the influenza vaccine is no different, Lisa. Now, the different public health offices across Alberta will hold various immunization clinics, and where children as well as adults can be immunized for the influenza vaccine.
And if I was immunized last year, do I need to get immunized again this year?
Well, there are many strains of influenza, and we seem to see different strains circulating each season. Because of this, the World Health Organization conducts yearly studies about the different circulating strains, and they discover which ones will pose the biggest potential threat to humans. From those studies, they will make a recommendation on which strains to be included in the upcoming season's vaccine. So in other words, Lisa, every year we're vaccinating for slightly different strains. So it's important that all Albertans over the age of 6 months receive the influenza vaccine every single year. And it's important for us to be immunized, not just to protect ourselves, but to help protect those around us. I'm sure anyone watching knows somebody who is battling cancer, bringing a new baby into the world, or someone who is frail and elderly. And it's these individuals who are the highest risk for serious complications from influenza. Not only that, but some of these individuals may not be able to receive the vaccine, or they may have a weakened response. So it's important for us to protect ourselves and those around us. And once again, the dates and times of those influenza clinics can be found at ahs.ca/influenza.
Great, thanks, Jen. That's some really great information. And with a lot of people gearing up to be traveling over the holiday season, I think that's really great information. So remember to protect yourselves and protect your loved ones. I'm Lisa Squires, and this is Health Matters.